Breast cancer: what are the causes, risk factors, and symptoms? Today I will try to cover the topics below. 1. Overview of breast cancer. 2. Causes of breast cancer. 3. Sign and symptoms of breast cancer for men and women. 4. Risk factors responsible for developing breast cancer. 'Breast cancer is cancer that forms in the cells of the breasts. 'After skin cancer, breast cancer is the most common cancer diagnosed in women in the United States. 'Breast cancer can occur in both men and women, but it's far more common in women. Causes of breast cancer: it includes inherited breast cancer. Doctors estimate that about 5 to 10% of breast cancers are linked to gene mutations, passed through generations of a family. A number of inherited mutated genes that can increase the likelihood of breast cancer have been identified. The most well-known are breast cancer gene 1, BRCA1, and breast cancer gene 2, BRCA2, both of which significantly increase the risk of both breast and ovarian cancer. If you have a strong family history of breast cancer or other cancers, your doctor may recommend a blood test to help identify specific mutations in BRCA or other genes that are being passed through your family. Sign and symptoms of breast cancer for men and women. One. Signs and symptoms of breast cancer in women may include a breast lump or thickening that feels different from the surrounding tissue. Change in the size, shape or appearance of a breast. Changes to the skin over the breast, such as dimpling. A newly inverted nipple. Peeling, scaling, crusting or flaking of the pigmented area of skin surrounding the nipple, areola, or breast skin. Redness or pitting of the skin over your breast, like the skin of an orange. Two. Signs and symptoms of breast cancer in men may include male breast cancer symptoms can be similar to those experienced by women and may include lumps in the breast, usually painless. Thickening of the breast. Changes to the nipple or breast skin, such as dimpling, puckering or redness. Discharge of fluid from the nipples. Risk factors of breast cancer. Factors that are associated with an increased risk of breast cancer include being female. Women are much more likely than men are to develop breast cancer. Increasing age. Your risk of breast cancer increases as you age. A personal history of breast conditions, lobular carcinoma in situ, LCIS, or atypical hyperplasia of the breast, you have an increased risk of breast cancer. A personal history of breast cancer. If you've had breast cancer in one breast, you have an increased risk of developing cancer in the other breast. A family history of breast cancer. Inherited genes that increase cancer risk. The most well-known gene mutations are referred to as BRCA1 and BRCA2. Radiation exposure. If you received radiation treatments to your chest, as a child or young adult, your risk of breast cancer is increased. Obesity. Being obese increases your risk of breast cancer. Beginning your period at a younger age. Beginning your period before age 12 increases your risk of breast cancer. Beginning menopause at an older age. If you began menopause at an older age, you're more likely to develop breast cancer. Having your first child at an older age. Women who give birth to their first child after age 30 may have an increased risk of breast cancer. Having never been pregnant. Women who have never been pregnant have a greater risk of breast cancer than do women who have had one or more pregnancies. Postmenopausal hormone therapy. Women who take hormone therapy medications that combine estrogen and progesterone to treat the signs and symptoms of menopause have an increased risk of breast cancer. The risk of breast cancer decreases when women stop taking these medications. Drinking alcohol. Drinking alcohol increases the risk of breast cancer. That's all for today. Part 2 will be coming soon. Thanks for your kind watching. Please like, share, and subscribe my channel for next helpful updates.